Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, the podcast turns to food safety. Recent reports have raised questions about the FDA's oversight of food safety, even after a law passed in 2010 was supposed to go a long way towards making food safer. Dr. Josh Sharfstein speaks with Howard Sklamberg, an attorney with the law firm of Arnold & Porter and a former deputy commissioner of the Food and Drug Administration. After recording this episode, Dr. Sharfstein called Sklamberg back to ask about the recall of infant formula, and we've added that conversation at the end. Let's listen.
Howard Sklamberg, thanks so much for joining me on Public Health on Call. Our topic is food safety, which comes into the news usually every couple of years because of an outbreak. There is an outbreak that happened in an infant formula plant recently. And there's also been some reporting about weaknesses in the food safety system. So thanks for coming.
Thank you for having me.
Now, you have played a big role at FDA, Food and Drug Administration, including a role that has important responsibilities for food safety. So I just wanted to start by asking you to describe the U.S. food safety system.
Sure. And using the word system in singular is being kind to it in some ways. There are a bunch of different players who have important roles, governmental players, in guaranteeing food safety. So the Food and Drug Administration has jurisdiction over about 80% of the food supply in the United States. USDA has jurisdiction over about 20% of the food supply. And USDA's jurisdiction is things like butchering of raw meat, chicken, poultry, things like that. FDA is like everything else, and processed food, produce, things like that. And the dividing line between USDA and FDA can get complicated, as an egg leaves a chicken and then ultimately becomes a whole egg and then ultimately is processed in a food, the jurisdiction can change. And on top of that, the EPA plays an important role because the EPA determines what pesticides can be used, which then FDA enforces. The alcohol is regulated by BATF, some types of alcohol in the federal government. And then states and local governments, as you well know, Josh, play a very important role. States perform a lot of inspections in coordination with FDA, and they do a lot of the oversight over things like produce. And local governments have jurisdiction over things like restaurants, and states and local governments over things like supermarkets. And not to mention foreign regulators for food that's imported.
So now I understand why you said food safety systems. There are many, and it seems like all of them could touch on a single egg at some point in its life.
That is absolutely correct.
Now, let's go inside the FDA, which, as you said, covers 80% of the food supply. How does FDA organize its food safety efforts?
So within FDA, obviously, the commissioner is the boss. I'd say most of the commissioner's time is spent on medical products because most of FDA's budget, which is user fees and money from Congress, is medical products. However, most of FDA's inspections are food. About 2/3 of FDA's inspection budget and 2/3 of the inspections FDA does are of food. And the work in overseeing food is divided in FDA in a few places. One is the Center for Food Safety and Applied Nutrition, which is kind of the science part, science and policy engine in FDA for food safety. So it does things like determining standards, determining what additives can be in foods, determining compliance policy. So in other words, what should be prioritized when FDA does inspections and enforcement, writing a lot of the rules. So, what can be in the water that's used in farms for produce. And also it has jurisdiction over things like dietary supplements and cosmetics. And it has specialty offices, some that deal with things like dairy, some that deal with things like seafood, which have their own special food safety concerns. Then there's the Office of Regulatory Affairs, which is a separate reporting line in FDA, which does the inspections. And as I said before, 2/3 of ORA, as it's called, budget is food inspections. And then there is a deputy commissioner for food, who is a fellow named Frank Yanis. And he is kind of a spokesman. He works on outbreaks and is a spokesman for some food issues. All the heads of those three entities I talked about, deputy commissioner for food, the director for the Center for Food Safety and Applied Nutrition, it's Dr. Susan May, and the head of the Office of Regulatory Affairs, they all report directly to the commissioner and don't report to each other. So there's a coordination that has to occur.
Yes, some coordination has to occur. That seems to be stated with some degree of understatement there. Now, let me ask you about a very important food safety law that passed while I was at the agency. What is the philosophy of that law, and what has FDA been working on to secure the safety of 80% of the food supply?
Sure. So that you're speaking of the FDA Food Safety and Modernization Act, which goes by the acronym of FSMA. And like a lot of advances in what FDA does, it kind of occurred in response to a bunch of tragedies. There were a bunch of outbreaks, as you remember, Josh, in the 2000s involving produce. A lot of spinach was one, peanuts. And the Food Safety and Modernization Act general philosophy is you can think of an approach to food safety in two ways, and I'm caricaturing it a little bit, but this is basically it. One way is you find a problem and you react to it, and then you kind of do enforcement. So there's an outbreak, you determine where it's from, you send inspectors there, they do what they're going to do, they may take compliance action, then you deal with a recall, and then you kind of move on. The better approach, which is very much underlies FSMA, is preventive. So, and this is the approach to the way drugs are regulated, which is you set up a system of rules that will really kind of govern how you are supposed to manufacture or grow food. And they're called preventive controls. And they govern all kinds of, how you're supposed to oversee your suppliers, what steps you're supposed to do to make sure your manufacturing process is going the right way, how you're supposed to react. FSMA empowered FDA to issue a bunch of rules establishing preventive controls. It also gave FDA a lot more authority over produce and over food imports. And we import a lot, like the vast majority, for example, of our shellfish and seafood are imported. An increasing amount of our produce. Like an example I give, you and I, Josh, are roughly the same age. When I was a kid, you couldn't get watermelon in the winter. And it was kind of a sign of summer that you could get watermelon. And now, of course, you'd say that to somebody who is 20 years old. Like, what do you mean I get watermelon all the time? And that's because it's imported. And the reverse, for all kinds of fruits. So a lot of our produce is imported. And what FSMA does there is it sets up a system realizing FDA can't inspect all around the world all the time, where there are private entities that are accredited by FDA that can help overseas food production.
So you're answering the question, how could food safety be so complicated? Because it sounds complicated. You have rules, you have a lot of responsibility that companies have to find the key preventive controls and implement them. You have these inspections going on. And lately you've had some more food outbreaks and an investigation, long article by Politico saying that the system really isn't working as intended. Some of those rules haven't been written. The coordination that you talked about before isn't occurring. How do you size up the situation at FDA?
I would say that, in a couple of ways. I think first, it's important to recognize the advances in the last 10 or 20 years. So you mentioned FSMA, Josh, as one. Another part of FSMA I forgot to mention, which is critically important, is the further integration of the states and FDA in how they work together. So there are a lot of state contracts and grants and joint programs, which are part of FSMA to try to make it an integrated food safety system, which is part of the lingo. I think the challenge is kind of well stated in the article, which is this is a very disparate system with a lot of pockets of government authority that have to work together and agencies with different cultures. And that can be challenging. You mentioned the egg leaving the chicken that can change jurisdiction 3, 4, 5 times before it's on someone's plate. Not to mention if it's in a restaurant and you get, local governments involved. So I think that kind of integration is challenging. And that's the way it is across the federal government when you have lots of agencies working on one issue. I think on the positive side, and I think the article in question didn't really talk enough about this in my view, is one of the ways you deal with a resource challenge. So the food supply, the number of imports, for example, into the US grows for food about 6% a year. The import resources of FDA do not grow by 6% a year. So what do? You either just don't oversee or you get more efficient. So FDA has gotten better at targeting risk for food, what food is riskier and deserves its oversight. It's also gotten a lot better with technology. So there's something called whole genome sequencing, which when there's an outbreak, so you can imagine a bunch of people get sick and we think it's from a fast food store somewhere. Okay, well, what's making them sick? And you have to do what are called tracebacks. And so you look and you try to find the common event. And kind of the paradigm would be a big wedding and there are 100 people there and they all get sick and the same symptoms. And then you think it's something at the wedding. Well, then you figure out, well, what do they eat? And what that often boils down to is trying to actually find the specific thing. So if it's produce, what is it? And whole genome sequencing allows investigators to look back at the DNA and determine with much more precision what is causing an outbreak. That means, paradoxically, there are in some ways a lot more recalls now than there were years ago, because we can detect better now what is causing an outbreak. That 100 people got sick, and the reason they got sick is because of listeria from this one place in Colorado. And that could not be done 15, 20 years ago. And that is a big improvement.
So the scale of the food safety challenge is obviously extremely difficult. We're uncovering more food safety problems. Do you think that some of the big solutions that people are talking about are advisable? There has been for many years a recommendation for a single food safety agency from the National Academies of Science, Engineering, and Medicine. Other people say, if we can't get that, just move everything out of FDA into USDA, and have at least USDA handle things. Versus, essentially continuing to take it one day at a time at the FDA, maybe get better coordination, finish writing the rules, and putting in place, better technology and just sort of climbing up the hill. How do you view the path forward?
Yeah, so I'll start off by saying, if you were starting with a blank piece of paper, if we were starting a new country, no one would design a system like this. It doesn't make sense. You wouldn't have this split authority all over the place in the federal government, and you would have a unified food agency. And the question of where exactly it reports doesn't matter so much as that it would be unified. To get to that ideal state would be unbelievably difficult. It would not just require legislation, but USDA and FDA are incredibly different. And it's not just that they're different agencies. The way they operate is completely differently. USDA has a model of having a person sitting in a plant while the plant is open every day. FDA's model is to inspect it every couple of years and use other signals to monitor. Quite different. USDA has 20% of the food supply, but 80% of US federal government's food budget. FDA is flipped. So you'd have to kind of put those together. You have to make the models make sense, that they're overseeing the food supply in the same way. And the question with any large government reorg, I ask myself, and I've been myself involved in some smaller ones, is the ideal state kind of worth the effort, or is it a distraction from other steps you can take?
I thought you were going to say, is the juice worth the squeeze? But maybe that's an inappropriate analogy.
I was going there, but I thought we'd then have to get into HACCP rules
for juice.
Juice, which is the food safety regime for juice and seafood. I think looking at it, take DHS, which was created, after 9/11. That's a more rational way of organizing those parts of the federal government. People would still argue whether it made a material difference, and there have been a lot of growing pains. So I support that as a goal. I'm not sure if you gave me an amount of effort that'd be put into dealing with food problems, that would be the first thing I would do, because I think it's improbable to happen, frankly. I think what you can do is FDA does need a lot more resources. We talked about the import problem. Congress has sometimes an annoying habit of giving a FDA additional responsibilities without additional resources. To give you an example, the food center in FDA is about 1,000 people. The drug center it keeps growing, is nowadays 6,000. The drug regulation in FDA is funded in large measure by user fees that drug companies pay when they submit applications to get drugs approved. There are almost no user fees for food safety, just a few for like food additives. So that comes out of the budget. And so it's a much more challenging budget scenario. And just an example that always happened in FDA. When I oversaw the inspectorate, so I did food and drugs. When you'd have a meeting with the food center, it'd be like 3 people. When you have a meeting with the drug center, it would be 20, and there'd be like note takers and project managers. And it's just a very, very different operation. The pay is different. The people in FDA who work on food often get paid less because the folks who work on medical products have special pay from laws Congress passed. They get paid a lot more. So there's also kind of a morale thing, even though a lot of the people in the food center are, PhDs and MDs and the like.
So short term, there's an agenda for FDA, get better coordinated, use technology better. There's an agenda for Congress, more resources for an agency which has an enormous responsibility, and maybe long-term, some thinking about how food safety could come together better in this country.
I agree with all that. And if we're going to go toward a unified agency, you can't, to use the phrase, boil the ocean. You can take steps in that direction about unifying control and increasing coordination with maybe a unified agency as a long-term goal.
Howard Sklamberg, thank you so much. And good to see you on the podcast.
Thank you very much.
Hello, Howard.
Hello, Josh.
I'm calling back about our food safety podcast because it turns out that there have been some developments since we recorded, and I'd like to ask you a couple quick questions about infant formula.
I'd be glad to answer them.
So one question to start is whether infant formula is regulated like other foods, or how is it regulated differently?
It's regulated by the food program of FDA, but much more intensely than typical foods. So when you have infant formula, you're dealing obviously with a vulnerable population, and you're also dealing with a population that is getting most, if not all, of their nutrition from that particular source. So the regulation of infant formula much more closely looks at the nutrients that are in the formula, and it has a bunch of tests regarding quality and nutritional content that would not apply to typical food items. So FDA is not concerned about the nutritional content of lasagna, but it is about infant formula. And there are a bunch of provisions there's a much more strict oversight over recalls. There are requirements about reporting to FDA when there are issues with the quality of infant formula. So it's a much more rigorous regulatory regime.
So we had been talking in our podcast about some of the challenges facing food safety regulation. Do these challenges apply to the regulation and oversight of infant formula?
Yeah, they're similar type issues. So we talked about, the organizational issues in FDA. You have an inspectorate and you have a food program. And we talked about resource challenges in FDA. Infant formula is a particularly high risk product. So we tend to get more priority at FDA than lower risk food items. But it's the same basic set of issues we were talking about before.
So huge consequence, as we've seen, if things don't go well, and maybe a good example of why some greater attention on food safety is needed more generally, and then obviously particularly for this critical product. Now, I've been reading that just recently there's an agreement that FDA has reached with the company. Can you just talk generally about what these agreements are? I think they're called consent decrees, and how they work to fix problems that may come up in the food system.
Sure. A consent decree is basically a civil plea agreement. You can think of it that way. So a company and the Department of Justice, speaking for FDA, agree to a set of conditions that then become a court injunction or court order. And consent decrees typically have a bunch of provisions that require independent monitoring of the operations of a food company or a drug company. They're used across what FDA regulates. And so they'll require companies to hire independent monitors to make sure that the products they're producing are up to FDA standards. They'll require a bunch of reports that go to FDA on a regular basis, because as a resource question, FDA cannot be in the plant day by day, but it often doesn't want to shut down a plant, whether it's infant formula or drugs. So the way they do that is by having a requirement of an independent monitor to get FDA all this information, which FDA looks at real time. And then also there are typically consent decrees requirements about how to get a company into compliance to meet FDA's standards and keep it there. And also requirements that give FDA additional powers of oversight.
Well, it sounds like that may be part of the solution here. I'm sure there's going to be a lot of reflection and investigation on what went wrong in order to prevent it from happening again. I do think one of the larger points is that this is set in the context of the overall challenges of the food program, and both the narrow issue of formula and the bigger issue of the food program should be on the agenda for improvement.
Yeah, I think that's right. I mean, this is part of the food program, and a lot of the issues we talked about last time would apply equally to infant formula.
All right. Well, thank you very much, Howard, for getting back on here with me. And I hope this is the last time I'm calling you before this podcast airs, because otherwise it will be because there's another major food issue and we could just keep going on like this. So hopefully that won't happen.
We'll do it sometime in the future in a more happy issue.
Okay. Thanks so much.
Bye-bye.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.